a lot of the things that I want to talk about. But anyway, I'll have a go. Just before I get started today, I also would like to acknowledge the traditional owners of the land on which we're meeting and pay my respects to the elders past and present and to any Aboriginal people that are here today. What I want to do today is just give you a bit of a plotted history of the program so that we can understand the context of the reforms, and then give you a bit of information about the sector response to the Commonwealth Home Support Program discussion paper. And I can't say CHISP and I can't say CHSP, so you just have to put up with the whole word at the moment. So that's my plan. Just as a starting point though, I'd like to talk about ACS just very briefly. I'm sure all of you already know who we are. We're a peak agency for service providers across New South Wales and ACT. Many of you are members of ours that I can see sitting around, and some of you are actually on our advisory committees. We represent about 300 organisations across the state and ACT, and those members range from very small operators right through to the large Big 10 operators across the state. We have a network of regional committees and advisory committees that feed up to us, and that's where we understand from the sector what the issues are and what some of the policy areas that need some discussion with government are. Really, our organisation started from a platform of residential facilities, and over the last 10 years we have moved into the community area, and more in the last 3 to 5 years a lot of smaller hack providers have become members. So I think one of the strengths of our organisation is that we cross the gamut, small and large organisations, and we also cover the whole geographical area. So I think that's one of the wonderful things about the organisation, and it is a federated organisation, and that's really important at the moment in terms of that lobbying and advocacy in Canberra, which I understand is why you guys are moving that way as well. Okay, so in terms of the hack program, who's game enough to put their hand up to say they've been around since the beginning? Anyone? Glenn? Yeah? Well, I've been around way too long because it was the early 90s when I first got involved in hack, and that was through local government. So home care was the first of all the programs, and I think the home and community care program was the first. We forget about that. It has been around for a long time. When the transition occurs next year, it'll be 30 years. So it is time for change. The other programs came a little bit later, during the 90s, and it currently services, I don't know the exact figures, Raj may know, but I know it's well over 600,000 people. Now in 2010, as part of those COAG reforms then, the health reform agreement, there was a decision that HAC would transition and that the federal government would become responsible for all services to people over 65. Okay, when they took that on, I don't think they realised the complexity of HAC, as we all know it, and how grassroots it was. So I think perhaps that in some areas they've been reeling about that since then and grappling with how they transition and how they work through these reforms. And so we're all helping them along. Just in terms of the last 10 years, if you have a quick look at that, those people that will remember back to the Way Forward in 2004, and that was a consultative process that was looking at better coordination across the sector. Then it was actually 2006 when COAB talked about streamlining the services, and as I said, the National Health Reform Agreement in 2010 saw complete changes for the HAC sector. I think two of the most important reports that have certainly influenced public policy in the last couple of years are the Productivity Commission reports in 2011, the Caring for Older Australians and the Disability Care and Support documents, both of which have a focus on the well-being of people in the community, promoting independence, giving them choice and retaining their community engagement. But that was within a balance of individuals having responsibility, affordability for taxpayers and a safety net for those that need it. And I think we have to keep remembering back to that with all of the reforms that are going on and any of the suggestions that we're making to move forward. So, as a result of those reports, the first policy that we had from the previous government was the Living Longer, Living Better policy. And that's, helped us to move to where we are at the moment in terms of the reforms. And then the coalition government, 2 days before the last election, came out with what's called now their aged care policy. And that was on a platform of a 5-year Healthy Life Better Ageing agreement. And that agreement is being negotiated at a very high level. And While they retain most of the living longer, living better suggestions in terms of that policy, there are a few differences, and one of the things that they're quite committed to at the moment is the reduction in red tape, which Raj alluded to before. The other major thing that happened around that time was also that aged care transferred from the Department of Health and Ageing to the Department of Social Services, which also saw a period of hiatus in terms of the reforms, and I guess that's some of the concern that we have at the moment is the speed with which things need to happen over the next 12 months. One of the things that both governments were committed to in both their policy directions was being engaged with the sector. And how they've done that is through an aged care sector committee, which recently met in May. That was a new committee. They disbanded two previous committees that previous government had established, and this government has established a new committee at that level. And as I said, one of the things that they're really working on at the moment is those opportunities for reducing red tape. The other group is the National Aged Care Alliance, which people have talked about already, and that's a representative group of providers, consumers, professionals and unions, and ACSA is represented on both of those groups. So our federated body is represented on that. And the NACA group also has convened a range of advisory groups on key aspects of the reforms, and we've worked on that with the department, and Raj mentioned one of those before in terms of the one Anne and I were on, which was the Service Group 5 subgroup. That just gives you, I know you can't read it, but that just gives you an indication of the number of groups that are engaged in the reforms at the moment. So all of those are various stakeholder groups. And where you see the yellow lines are areas that ACSA are represented on. So we are quite engaged in all the reforms at the moment. And that is one thing that I would say about the department. This isn't just a process that they've set up to that's tokenistic in any way. They actually do listen, and they have been listening. Obviously, they have to make decisions within fiscal policy that they're confined to, but they are listening. And there's already been some shift in lots of areas. So one of the groups that I particularly wanted to note for you was the Home Support Advisory Group, and there's a number of subgroups that sit off that, which were where all the reviews took place, and they managed that process. You can have a copy of that at some point if you like it. Now, just in terms of where we're up to, the Home Support Advisory Group did a lot of work, and I'm sure you all read the design paper that was about the Commonwealth Home Support Program and the respite paper around how respite fit into Commonwealth Home Support Program. So as a result of that and the number of service reviews that were going on, the department has put together their latest document, which is the Commonwealth Home Support Program discussion paper, and that's really what we're here for. In terms of that policy, there's broad agreement within the sector on the direction of the policy, but there are some issues, obviously, with some elements of it, and we will be feeding that back to government over the next couple of days as I finish off those papers. Raj did go through what the key directions are, but I'll just basically run through them, then talk about some of the areas that we have some concerns about, or not concerns, but we need some further clarification, or want to make sure that we ensure that the direction that they go within the guidelines and the manual support where the sector's at. So it is a program for basic support. There's a change to service groups, which is what the NACA group had recommended, but the outcomes will remain while they're outcomes focused, it will remain output-based funding because they're going to continue block funding in the short term. So that's a bit of an issue that we do need to kind of contextualise as well. Service Group 2 will be delivered through other elements of the Commonwealth Home Support Program or the broader aged care infrastructure. And the gateway, or the My Aged Care, will be the entry point for all clients. ACATs will assess for residential and home care program, and local assessment organisations will assess for the Commonwealth Home Support Program. And that will go out to competitive tender this year, I imagine. The linking services will provide short-term case management and work with vulnerable clients. Sector development, and some of those roles you're well aware of around the HACDOs, will have targeted functions, and again that will go to competitive tender this year. The wellness and reablement focus across the program we think is a great thing. There's a network of restorative services to be established. There's a new fees policy, and the subgroup's already met, had their initial meeting for that. And the ACHA program, we're still unsure where that's going to go yet, whether they'll fit into the program or there's a number of options. And we've met with the ACHA group nationally, and we have a final meeting on Friday with them. So I've got a position paper together for that. And there will be contestability was the other direction that we were a little concerned about when we saw that in the paper. And I'll talk about that in a minute. And there's a review in 16-17. So I'm not going to talk about all the areas that we need clarification on, but just some things that I think are relevant to you. So in response to the Service Group 5 elements, particularly in home mods, obviously you're aware that there's a cap of $10,000 now in subsidy. Now, and I was on that subgroup, and we'll talk about that in question time, no doubt, about how we came to that cap. But in terms of a response from my members, I will still be feeding back to government that there's two issues for us. One is about the tiered structure in New South Wales and what does that mean for transition for you guys. And then the other thing is about is there any provision for hardship arrangements? So for people that can't pay the difference between their modification, is there any other arrangements that we can look at for those people? In terms of goods and equipment as a service type, all of you would be well aware that it's not equitably distributed across the regions or nationally, but access to assistive technology, as we've heard from Mary as well, is really fundamental to helping people remain independent. And there's some real interface issues for us at the moment around some of the state-funded equipment groups like Enable New South Wales, because there has been a bit of a pushback at the moment around services for older people. So there's some of the things that we'll be working on over the next 6 months. With regards to entry and assessment, some of the areas, this is going to be a major change for the sector. And so there's quite a few areas that we need to clarify around this, and that includes the fact that we need lots of communication with providers and the community. We need a really clear design process. And we also need some contingencies, like our preference would be for a no wrong door policy. If people walk into a service or a centre, then, you know, we can work through that with them and do some of the assessment stuff in the background. Also, a recognition that assessment is an ongoing process. As all of you are well aware, it doesn't happen in one interview or in one telephone conversation. It happens over time. We're also a bit concerned about the IT requirements and the interface with the DSS systems, which I know you're all well aware of because of what happened with the access point. We need lots of training for the sector on the process and the IT interface. We need some strategies for special needs groups, because this type of entry and assessment may be a further barrier for people from core backgrounds and for Aboriginal people. We want to know how many regional assessment organisations there will be, and is there a linking service proposed for each regional assessment organisation? That none of that is clear yet in the discussion paper. And who are we considering vulnerable clients? Are they clients that are in special needs groups, or are there other factors that makes them more vulnerable? In response to the fees area of the discussion paper, as I said, the subgroup has met. The first meeting was in June. We do need some clarity around the expected movement in fees from 5% to 15% nationally by 2017-18. It's a huge shift. What is a simple means test, and who will conduct it? Is income the only factor? What about the capacity to pay? Understanding, you know, some older people may have huge medical costs, etc. And so all of those issues need to be taken into consideration around their capacity to pay. The fee scale needs to consider a range of variables like service type, volunteer-based, the geographic location, costing variations around product and services, and how will transitional funding for implementation of a fees policy be distributed and when? Because they're talking about, in the discussion paper, it talks about 2015-16 and 16-17. We kind of would argue that maybe that needs to be brought forward a little bit. In response to contestability, you know, broadly, I think the sector doesn't have any problem with contestability. It's about not having the detail yet about what will be contestable. So if you're going to move to a more of a contestable environment, then we would want to see that the planning framework is much better than it currently is. So we need some improvements around that. And again, like I said, we agree in principle, and we know that sector development will go to tender, the regional assessment organisations will go to tender, and some of the growth funds will go to tender, but there's no decision about other elements. And I know that the department is waiting for feedback from the discussion paper, but we're really interested in what that might look like. And, you know, it would be a brave government that would go to a fully contestable platform at the moment when we have 12 months to go. I think you would see, you know, the sector would fall apart, not only services but the clients as well. There would be a real dilemma. In terms of the funding contracts, we would also be asking why in the discussion paper it talks about a 3-year funding contract when most other elements of DSS grants are 5 years. And some of them are ongoing, obviously, in terms of resi and package care. With regard to some of the other considerations that we really need to work through are the interface between the home care packages and Commonwealth Home Support Program and the NDIS. Some of that is still not clear. The carer support centres that are now looking like that will be established in 2015. The quality indicator group, so there's a NACA paper that's been completed on that, and that's in the aged care facility realm at the moment. But I think the other key factor for all of you is to remember that most things that seem to be occurring in the resi space or in the packaged care space will eventually be moving across the home support program space. And so that's why it's important to keep up to date with the things that are happening everywhere, the reforms that are happening across the sector. The same with specified cares and services review. That's in resi at the moment, but will come across to the other areas of community. Fees we've talked about, the gateway we've talked about. They really need to do a lot of consultation, and this discussion paper and the roadshows that they've been doing have been part of that, which is wonderful. As I said, ACHA, they need to then, after they get feedback, what we would like to see is feedback to the sector about any changes, policy direction changes that they're going to make as a result of the feedback that they've received from the sector, and then the guidelines and the manuals being developed, and that there's a consultation process through that as well. They also need to develop the structured reablement process that they're talking about and streamline accountability and reporting. There's got to be an expansion of the National Advocacy Program, finalise the fee structure and policy, get the guidelines ready, do the tender processes before next year, communicate with everyone and develop the new grants. Good luck with that, DSS. So just in summary, these are the biggest reforms in aged care in 30 years. And so it's a move towards an end-to-end aged care system, as we all understand. And they are really encouraging the sector to get involved and to feedback, and they are listening, so you need to do it. There's broad support, obviously, for all of the reforms, but the devil's in the detail, which I think Anne mentioned before, and we really want to see that there are really clear guidelines and timeframes for the transition over the next 12 months. You will see that in July, 1st of July this year, there's a number of changes that will occur in the home care program space and residential space, and they've had just as much change going on over the last 12 months, probably more, in fact, than what we've had. And then from next year, it'll be the Commonwealth Home Support Program and the increased functions of My Aged Care. You need to stay up to date with all of the reforms across the sector. And I know that you've all been working out where you want to be strategically from 2015 on, and you also need to feedback. So whether it's through your individual organisations, your regional groups, or through the State Council, you must feedback, because this is your opportunity now to ensure that the program looks what you want it to look like from next year. There's some links and contact details if you need them.